the club. So
Oh, good. All right. Well, that's great. So how many do you have in your club?
I think active participants probably around 17, but
Good.
it's kind of tough to get a gauge on that right now during COVID, just because there's some online participation, some not.
Yeah, exactly. So are you guys do you guys go to class, or is it all virtual?
So go ahead, Emily.
Yeah, we have some classes in person and then some are online. It depends
Oh, that's
on what the
good.
teacher wants.
Oh, that's good. That's good.
Yeah.
Yeah, it's pretty much all virtual down here right now. They're really nervous about opening up the classrooms, but hopefully, it'll come in, this later this year. So that'd be good.
Yeah. As far as I know, I think we're one of the only institutions in Alberta offering in-person post-secondary. So I'm very
Good.
because
Oh, good stuff. All right.
So just starting off, Mike, why don't you tell us a little bit about yourself? Yeah.
Sure. Well, Mike Schierman, small town boy, Southern Alberta, Vulcan, Alberta, born and raised in a small farming community. I spent a good portion of my life at the University of Calgary, did undergraduate there, and then I went to grad school at U of C, and then went to medical school. So I'm kind of a boring guy. Stayed in Calgary. I like Calgary. I don't know. I'm a homebody, so no, it worked out really well. And I think here the thing is, Cole. I don't know. Just anytime you have to show your, kind of your street cred and everything, it's like, who is this guy, right? I mean, he's just some California guy. Well, I got something here I got to show you. So this is me, me right here, and I got to show you. There's Cole's dad. You see it? Yeah, I don't know if you can see it.
Oh, I think
Anyway,
I got him.
so it's me and Cole's dad right here. So it's there. So yeah, I'm a Calgary boy. So
That's awesome. My dad just got the Joe Kent Cubs jersey framed, and we got it up in our living room right now. So a little piece of you is in our basement right now.
That's awesome. Good stuff. Oh, that's good to hear. Yeah. So I think I saw a picture of that or something like that. That's pretty cool. Maybe I'll have to do that. I have to drag out my my jersey or something and frame it or something. Yeah. So anyway, that was kind of my journey. So starting, small town guy coming to, actually I did psychology as an undergrad, did a Bachelor of Science in psychology, and, kind of did the pre-med thing. The thing that kind of blew my mind, small town guy, and going to, first year science courses at U of C. I remember at Science B building. I'll never forget. It was a math class, and I remember sitting in that class, and the guy said, it's like it was yesterday. The guy says, how many of you want to go to law school? Like maybe like a quarter of them put up their hands. And how many want to go to medical school? Like 2/3. Like there was like, I don't know, 300 people in that science theater, and like 200 of them want to go to medical school. So it doesn't take much to say, your chances. This is in the 70s, for heaven's sakes, and so it was disheartening. So, I went through undergraduate, tried to get in medical school, and I tried different places, didn't work out. And I thought, I got to keep doing something. So I got into graduate school at U of C, and it was great, and enjoyed that, and got into medical school. And I graduated in the class of 1987, and pictures up there at med school. So anyway, so that's kind of my journey. And when I was in medical school, they give us a month to do whatever you want to do, like an elective. And I thought, it'd be nice to just get away for a bit, And I had a cousin that lived down in California, and she set me up with a family doctor in Danville, and followed him around for a month. And at the end of the day, he said, hey, we're starting this hospital. If you're at all interested, we'd love to, think about it. I'm going, you know, had to go through residency, well, finish off medical school, do my residency, and so, but I kept in touch, and yeah, so that's how we ended up in California. So the rest is history, you know.
That's awesome. Why don't you tell us a little bit about your practice in California currently?
Yeah, it's been, I've practiced in, I've been here since 1992, family medicine out of San Ramon Regional Medical Center. I've been there for a number of years, and used to do hospital privileges. I don't do that anymore. We have hospitalists here that do a lot of that. So that, you know, so just basically focusing on continuity care, outpatient primary care. And yeah, and it's worked really well. I've had a great time, and met some great people over the years, and so I don't know. I mean, I'm not sure how much of your group is a faith-based group at all, Cole, or anything like that, but yeah, it was a tremendous thing as far as meeting a lot of Christians over the years and everything like that. So yeah. It's it's been a big help to me over the years, for sure.
That's awesome. That's really cool to hear. But so let's rewind a little bit and go back. So you just finished your undergrad, and looked like medical school didn't work out kind of right after then.
Right.
So how did you kind of make that decision? How did you decide, yeah, I'm going to want to pursue a master's program? Were you advised that that'll increase your likelihood of getting into medical school?
Yeah, yeah, exactly. And my cousin actually is a rheumatologist at the University of Calgary, Marv Fritzler. I don't know if you've met Marv before, and Marv's just a great guy. I don't know, maybe you've even interviewed him. You should. He's a pretty amazing guy. Marv, that's what Marv said. He said, you know, you should really think about grad school, and in that way you kind of set yourself apart. And I think that's kind of one of the things I would just suggest to your group is that, you know, if you're thinking about medical school, you kind of have to get beyond just being an undergrad, and because it's just so competitive out there. So you have to kind of set yourself apart and kind of, you know, to be able to tell that story. And so yeah, I mean, and basically being able to go through grad school and making some great contacts there. And in fact, some of the folks that one of the ladies that I was in graduate degree, we both got into medical school at the U of C, and have been great friends over the years. So yeah, and I think it, in a way, it was just a really good way of you know, approaching that, and just the way that it all worked out in the final analysis. Yeah.
That's awesome. That's really great to hear.
Good.
Just moving, I guess, one step forward then into medical school. I understand U of C is a 3-year program, which is a little atypical. Did you enjoy that? Do you think that you would have on 4 years?
Yeah, and that's the thing. I think, you know, if you're doing some work, you know, looking into medical schools, back in the day, I mean, they've certainly increased the enrollment. I think they've doubled it over time. I mean, they've increased the size of the class. There were 72 of us, and it was an older class to begin with. In fact, I think one of my classmates got in when she was 42. And so they're looking for maybe a little bit more mature student, someone that maybe lived life a little bit. I always kind of liken it to one of my classmates who came from Montreal. He was he had a degree in music, of all things, and he got into medical school. Actually, Ron Siegel's actually become one of the preeminent endocrinologists in Canada, and so he's actually back at the U of C again. So, but he's at University of Ottawa, and but yeah, I mean, the reason I bring Ron up is that they just bring in a lot of different, you know, maybe older students, maybe some that are maybe from different types of you know, kind of backgrounds, you know, into U of C. Now, Edmonton, from what I remember, U of A was more of like, you know, it's all about grades, it's all about, you know, MCAT scores and things like that. It's that, you know, they like the young ones. So that's a different, maybe a little bit different kind of push in Edmonton. And but yeah, I mean, I think they're both excellent schools, and I think that you have great education in both of those institutions. Sorry, I got dogs around, so if they start barking, I apologize for that. They're kind of nuts.
Not a problem at all. And just kind of, you touched briefly on like how you selected family medicine. You want to talk a little bit more about that and kind of some options out there and what drew you to family medicine?
That's great. That's a great question, Cole. And you know, you always go through different things when you're in medical school. I mean, I always like to. I really thought I wanted to be a family doctor. You know, from when I was a kid. I grew up in Vulcan, right across the street from my family doctor, the guy that actually delivered me in Vulcan, of all things. And so he always, you know, used to tell me about family medicine. I always thought it was a great idea to be able to, you know, to get to know families. And I just thought that was really kind of a neat, kind of a generalist, not just specifically one thing. And so I got it. You go into medical school, you think, oh man, you know, I mean, I want to try to see different things, maybe orthopedics, maybe general surgery, you know, a number of different things. So you know, I was kind of one of those guys. Well, maybe I should back up a little bit. You always have the ones, the keeners. I don't know, maybe Emily's one of those. She kind of looks like it over there.
You nailed it.
You know, you get these guys. Oh man, I tell you, I did endocrinology, and Mike, I'm telling you, I'm gonna be an endocrinologist. Or I OBGYN. Oh, I'm going to deliver babies. And everything that they did, oh, I'm going to be the general surgeon. I got to be a surgeon. I was more one of those guys that was saying, well, man, I don't want to deliver babies, you know, check that off. But, you know, all serious though, no, I think it really came down to it's really solidified what my initial kind of desire was to do was go into family medicine. So that's kind of what it was. And what I thought was, you know, the nice thing about family practice is you could do so many different things. Runs the gamut of so many different things. If you want to deliver babies, you can. If you want to do some surgical procedures or assist in surgery, you certainly can do those kind of things. You know, even like an anesthesiologist and things like that. You can do a lot of different things through family medicine. So I think it just really brings out like a broad kind of just a real broad kind of practice. And it's interesting, I was just thinking when I was in my one of my general surgery rotations at Foothills, there was a surgeon there, a guy by the name of Mike Schneider. He actually, I don't know where Mike's doing now. He actually went over to Saudi Arabia to practice for the prince. He's like one of the best surgeons in Canada. And he was a family doctor. He's a family doctor initially, and he went in to be one of the top surgeons in Canada. So, and he used to say, you know, family medicine really gives you a real great grounding medicine. And so, yeah, and that's what I love about it is that, you know, you guys are young, you know, it's a great place to start if you want, and it's a great career to have. But if you wanted to do something else, you could also kind of veer off to other things and have a great grounding in the practice of medicine. So anyway, that's my 2 cents for family medicine.
So just adding on to that question, what would you say would be the best part of being a family doctor and maybe the worst or most difficult part of being a family doctor?
Oh man. Well, you know, it's interesting. It's always I mean, we were talking about that this morning, and I do some work as a recruiter for family medicine residents. We hire doctors, strangely enough, and we were talking about that this morning to a candidate, and I was thinking about a lady that I've known. I don't know. I've probably known her over 20 years, and taking care of her kids, and their kids are done college now, and she just looked up at me. She says, "You know, thank you so much for all you've done for my family." And I mean, I'll get choked up thinking about stuff like that. And again, it's like, where do you get that? I mean, where can you get that kind of reward, you know, where you can really make a difference? And you go, man, at the end of the day, you know, God, I am so blessed to be able to do this stuff. And so those are the kind of things, you know, those kind of things that nail you, and you go, man, you know, because here's what happens, Emily, you know, I mean, Cole said the life of a family doctor. Well, it's kind of the same. It's kind of the same thing over and over again. You know, you see different stuff, but at the end of the day, you go, man, you know, what am I doing? You know, do I make any difference in life? And when you get those kind of God sightings, just to say, wow, that's really amazing. That is really really something that I didn't even expect. And just get blown away. So those are the best parts of them. I got to say, those kind of rewards. Or when somebody says to you, thank you for saving my life, for different things you've done. And you don't even think it's that big of a deal, but it really was. It really means a lot to people. As far as the hardest thing, I think, is that understanding that, you're not God, you're human, and sometimes we make mistakes. Sometimes we don't say things the right way. And so I think that we have to take those, take those in stride as well, or even having to give people bad news that it, it's going to affect the rest of their life, or maybe even understand that their life isn't for very much longer. Those are the type of things that really are difficult, and just saying goodbye to people. Those people. I mean, you've been with them. I mean, I think my office manager and I have been together for so many years, and sometimes we'll just commiserate and think about some of the couples that we've known, those ones that have just, brightened our day, and they're gone now, and those saying goodbye. I mean, that the human journey, it's those are I think the difficult things.
And just kind of going off of that, like what are some of the strategies, or like how do you kind of deal with that and work through that on an emotional level?
Yeah, I certainly spiritually, that's certainly a strong part of it. A daily walk with God, and my spiritual aspect, and looking for wisdom that way. Certainly with my wife and my family, and my church, strong relationships with that, and just understanding that ultimately it's not about me, it's about God in those cases. And I'm just here to be a servant for him. That's really what it comes down to. It's funny, I have a friend of mine. I was just saying that we've got what I had always had a feeling about, just like these. Hey guys, Sudi, these dogs are gonna go crazy here. Hey guys, these, hopefully, guys, settle down. So anyway, what I was going to say, just like you have this club, what I kind of helped to start many moons ago is a kind of a Christian group where we get together and kind of talk about stuff, just like kind of this stuff, and just to, things that we're going through, and things that we're struggling with, and that's been huge as well. And so I think that's been, those are kind of some of the things that have been, really, really helpful for me over the years as well.
I think that's some really good perspective, and it sounds like you've got an excellent support network there. So
but my point, I was thinking, geez, I was going to make a point there. I know what the point was. One of the guys had a great saying to me. He says, Mike, what we are is we're good paid missionaries. And I go, yeah, that's a great way of looking at it. And you have to look at it that way, is that, this is what, if you've been called, if this is your calling to do this, that's, and that's a great thing. It's a great work. It's a great profession. And wherever you do it, if you want to be, I don't know, in Indonesia, Cole, right? Working with the Taliban or whomever, those kind of folks, or, in third world countries, or in Calgary, in Southern Alberta, and Northern, wherever, I think is where you're called to be. Is that's really where it is. That's really where the rubber meets the road.
I'm going back to a comment you made earlier. You said you were involved in some recruiting. What are some of the skills, and maybe some of the soft skills you look for in potential doctors?
Well, that's a great question. And I just had this question with a prospective resident that's coming out of our residency program, because she's going down to live closer to Stanford, and kind of the group down there, and the Palo Alto Medical Group, and she's interviewing there. She says, "So what do you look for?" And what I try to do is I say, really have kind of a concise, kind of real vision of what your passions are in medicine. Because here's what happens sometimes, you guys, is that we'll have some candidates that come in and go, well, I think I might want to do this, or I might want to do hospital work, I might want to do an urgent care, or I might want to do primary care. I don't know, I might want to go, do third world, medicine. And it's like, I feel like I'm a career counselor, And I don't want to be a career counselor guy. I mean, I'll be if if you want to talk about it, but that wasn't the venue to be a career counselor. I think just really know what you want to do. I mean, just really tell the story about yourself and really what your vision is and what your motivations are. I think that's what we're really looking for, and just being yourself. Not putting on airs. And that's the thing. Just being yourself. That's really what it comes down to, and really what your passions are, because that comes out. That comes out, and we have some folks that come in and they're just looking for a job. It's like, and if they want a job, there's a lot of places where we're really looking for that kind of that type of individual that kind of is a cut above. And we have in our medical group at John Muir, we have what we call is kind of our ethos, and it's 3 words. It's listen, think, care. And I think, when you really think about that, that's so important. So you're really listening to what the patient is saying to you, like just really tuning in on what are they really saying, and thinking about what's going on, trying to make some type of diagnostic decisions, and then kind of going that and kind of caring about them, kind of going that extra mile, maybe thinking about, I'll call them up tomorrow, just see how they're doing. I'm telling you, in the world that we live in, those kind of things go so far. People are blown away by them, you guys, and just that love that can come through to really minister to people.
So when you was talking about caring for your patients, how do you draw the line between caring for them and professional boundaries, and where are you trying to draw that line of, like, you want to care for them a lot, but when is it like you still have to maintain your boundaries?
And that's a really good thing. I think, Emily, what you have to do is really make sure that you are, you have, first of all, kind of ground rules that you put into place. For example, a male physician going with woman, doing a pap smear or something like that. You always have somebody in the room, because even if nothing happens, if you should be accused for things like that, just that other party that you have in there. So those are the kind of things that you have to put into place before you're in that moment. And I had a great, it's funny, a friend of mine who is an OBGYN, and OBGYNs, they sees a lot of women, right? And that's all he sees. And he'd say, I'd have patients come on to me, and what I do, and he says, I'd stop it because I'd have a picture of my kids, and he said, man, look at my kids here. Oh man, they're growing up. How are your kids doing? And just like that, it would break it. Anything that kind of that weirdness that would happen, he had that already built into place. He already had that kind of, so it wouldn't go to that next level. And I think that's where you have to do it, Emily, make a conscious effort to really short circuit those kind of things. Because here's what we do as whether you're a man or a woman, you're dealing with some pretty emotional stuff. People are pouring their hearts out to you. I mean, I'll have people come in, they look fine. As soon as you close the door, they just break down in tears. They're very incredibly vulnerable. And there's people that, there's some doctors that can get kind of lost in that kind of weirdness, and well, not weirdness, but I mean, they can get, emotionally attached. You just have to make a conscious effort to make sure that, you are the physician, you are the caregiver, they are the patient. You are not their, you have to watch. You can have an emotional relationship. I think that's what we want, but you have to, that fine line to not cross that line. I don't know if that makes any sense from my babbling, but it is a struggle. And I think that's something, that you have to guard against, because there are some doctors that have fallen over the years, for sure.
I'm just kind of rewinding again here. A lot of our members are thinking about medical school and kind of nearing the end of their undergrad. What is one kind of thing that maybe surprised you about the journey ahead after your undergrad that you kind of maybe wish you had a little different perspective on going through that?
Probably finances. It's so funny. My son just finished his mechanical engineering degree at San Diego State, and he's going into the Navy. He's going to be a nuclear engineer in a submarine. And he said, Dad, I know nothing about finances. And, and I think that's part of the, understanding kind of the value of money I think it's a necessary evil. I mean, not evil, but it's something that, you want to be respectful of. We had it's funny. I remember in family medicine residency at U of C, we had a financial day. And I'll never forget the guy said the first thing that came out of his mind, I said, I'll tell you one thing to do. This is the first thing you do is pay your taxes. Make sure that you understand you have taxes to pay, because I'm telling you what happens time and again. You get into practice, you start making some money. It's like, oh my gosh, you start thinking about all those things. And it's like, yeah, Mr. Trudeau's going to be coming for your wallet. He's going to want to he's going to collect those taxes. So anyway, those, I think financially for sure, is to really have a grounding and understanding that. What else? I think being balanced. I think balance is a really important thing. I think really making sure that you aren't just studying or just engrossed in your studies. Make sure that you take time for your rest. Make sure you get exercise. Start that discipline now, and certainly your spiritual walk too. Work on that spiritual aspect as well. Don't forsake that, because it's just too important. And those are the kind of things, those habits that you start early in your career, they continue on. So, and also just keeping things, making sure that you have your priorities, where they should be. And gosh, I think that's one thing, if, just not to ramble on, how, as far as the whole COVID thing is just understanding, what really are our priorities, and certainly family and our faith are really the important things,
This one's a little bit veering off topic a bit,
You're
but
gonna throw me a curveball, Cole? Is that what you're gonna throw me?
maybe a bit of one, yeah, or a riser for the.
A riser, very good. Good knowledge, very good.
I'm sure you rub shoulders with a lot of different medical professionals, and I think a lot of us in the club are not quite certain. We're not dead set on medical school. There's a lot of options out there, maybe like physician's assistant, that sort of thing. Could
Yeah.
you, touch on a few medical professionals that you work with, and some career options that you think would be good for us to consider?
Yeah, I think that's something that's really important. Now, I'm not sure. Do you have kind of extenders or physician assistants and nurse practitioners in Canada? Do they utilize them very much?
We have nurse practitioners a lot, especially in rural areas where there's no
Sure.
doctor. But I haven't heard of any physician assistants. I don't think that's very common.
Yeah, as far as I know, we don't have physician's assistants, but I've done a little bit of Googling, and I've heard that they might be planning on bringing some in, but I'm not 100% certain on the direct.
Yeah, it's really quite big here in the States. A lot of nurse practitioners, kind of, they basically, the way it works is these practitioners, they work under with a practicing physician and bill for their services under the billing code for the physician that they're under. I think actually the law in California has changed this year that they can bill, outside of that more independently. But I think that's really a good option. I'll tell you a story. This guy that was telling you about being well-paid missionaries, Dr. Humphrey. Tremendous. You should actually interview him. He is phenomenal. He's brilliant. He's man of faith, but he'll blow your mind. But his daughter is she's brilliant, right? And she got into wherever she wanted. But here's what she was thinking. Do I want to do a medical school? Do I want to do 4 years and then residency for at least 3 years? She says, I want to be a PA, a physician's assistant. She got in at Stanford. Now it's, I think, a 2.5-year program. They're basically taking the same kind of, kind of subjects and everything and rotations at the medical students. She was blowing them away. She was at the top of both classes, right? And I think she's actually graduated now. But her thought was, do I want to invest all this time and certainly all the money that you have to do to go to medical school, because it's not cheap, And she can practice now after 2.5 years and make a good living and have a great practice. So I think that's always something. And as I mean, not to be sexist, but I think it's the reality. A lot of women want to start having kids, and they want to be able to. Hey guys, knock it off. My dogs are barking again. So I think that's something we really have to consider. I mean, I have had. I mean, and again, not to speak, like any derogative terms or anything like that. But I've had a lot of friends of mine who are, young women that are thinking about surgery. Well, and that's great, but you have to always count. You have to count the cost to be a general surgeon. You're looking at, of course, 3 or 4 years of medical school. You're looking at 4 years of residency, probably a fellowship on top of that, or subspecialty, maybe another couple of years. And then you thinking, wow, but you think, well, that's when it'll end, right? No, that's when it's just beginning. You're on call, if you join a group, you're probably going to get the low part of the totem pole as far as call is concerned. It's just, bottom line, it is a really tough road to hoe. And so I think, something like a PA is a great option for a young man too. I think it's a great idea too, because then you can, if you wanted to do third world medicine, a lot of folks do that as well. So I think that's a great idea as well. But what else? Any other questions or all? Any other kind of other medical kind of specialties or anything you were wondering about, Cole?
No, I think that pretty much that covers it. I think I was just kind of curious about some other options. So I think that's great. Emily, anything else? No, awesome. Thank you so much for your time, Mike. I really appreciate it. I know everyone club will really enjoy it. So yeah, we really appreciate it. Thank you.
Great. Well, listen, and if you want to give my contact, certainly go ahead and do that. Or if there's anything else, maybe, hopefully at some point in time with COVID going away, we'll be able to, get back up to Canada and maybe have coffee or something like that, or some Timbits or something like that,
Well, I'd really appreciate that. Thank you so much, Mike.
Great, you guys. Thanks so much. It was a lot of fun. Let me know if anything else you need, okay?
Awesome. Thank you so much.
All right, guys. Nice meeting you, Emily. Take care. Bye-bye.